This patient with left brachial lobe graft post-thrombectomy sent for assessment. The brachial artery at mid-upper arm, it is patent, it shows low resistance waveform. We follow the brachial artery pre to the anastomosis, and still it's patent with low resistance waveform. Now when we move to brachial artery post to the anastomosis, for sure the flow now it will be high resistance. We can see that the wave now is biphasic. Now we'll scan the brachial lobe graft at the arterial anastomosis. Actually here it will be the arterial anastomosis, and here it will be the brachial artery. So mild narrowing seen at the arterial anastomosis. The velocity is elevated, it's almost 500, and the peak systolic velocity ratio it was 2, which suggests to be mild stenosis. The graft it is patent. We keep follow the graft at the arterial side, at below elbow and at mid forearm. Here we can see there is some irregularity, and this most likely probably due to the puncture. Now we follow the graft at the venous side, also at the mid forearm, and at below elbow the graft it is patent. We measure the flow volume, which was good, it's almost 900. Now we move to the venous anastomosis, and it will be at this area. But after that we can see that the brachial vein it is seemed to be narrow. So by color and pulse wave, the venous anastomosis it's patent and no sign of any stenosis. When we follow the brachial vein by color, we can see that how the vein it seemed to be diseased. The velocity it is high. We keep follow the brachial vein, and we have aliasing. So we have long segment of the brachial vein just after the venous anastomosis. The brachial vein it is diseased and narrow. We took several velocity. Actually we are keep looking for the maximum velocity, and the velocity it is more than 500, and actually the ratio it was 6 to 5.8. It means we have significant stenosis. So the brachial vein above elbow just after the venous anastomosis it is disease, display long narrowing with significant stenosis. After that the brachial vein at mid upper arm it's beta, and now it show good caliber. We follow the vein till proximal upper arm. Now we scan the axillary vein, and also it is patent. We scan the subclavian vein distal, and it's also patent. And we scan the subclavian vein proximal, and it is patent. Now when we scan the subclavian vein more proximal toward the junction with the internal jugular vein, we can see here we have narrow, and the velocity for sure it will be high. And when we measure the velocity it is 211. Actually the ratio it was 2.6, suggesting also mild stenosis at the proximal subclavian vein, just near to junction with the jugular vein. We can see here we have the area which is narrow, and here the jugular vein. Both they will join to give us the brachiocephalic vein, and actually the brachiocephalic vein it was patent. So the left brachial lobe graft it was patent with good flow volume, but it show mild stenosis at the arterial anastomosis, and also there is mild stenosis at the proximal subclavian vein, in addition to long significant stenosis in the brachial vein just above to the graft venous anastomosis.